a patient with anterior wall MI. This patient came with fever and high grade fever, very toxic. There was a mass out here. This patient later on got operated and this mass turned out to be tuberculosis. Here this patient has both LV and RA clots on the apex of both. So LA thrombi also can be picked up in patients of mitral stenosis and AF because of dilated LA and stagnant flows. Here there is a patient, you can see there is a thrombus at the LA appendage. This is also a patient with a RA, there is a big thrombus here in the transesophageal, you can see a big thrombus here which is very mobile. This is a ruptured sinus of Valsalva, this is the aorta and you can see the sinus of Valsalva here and you can see it is ruptured and the flow across it. In CVA, what are the cardiac reasons? You can have LV-LA clot which I have just shown you. Infective endocarditis also can break away, a piece of it can go and cause stroke, intracardiac masses, aortic atheromas and paradoxical embolus through a PFO. All these can cause a CVA. So, we have to look into it when a patient comes with stroke. Here you can see a transesophageal echo of a patient with a stroke. You can see this atheroma in the aorta, very mobile. Here also you can see an atheroma in the aorta. This is another case of pacemaker, lead vegetation. You can see the fluttering vegetation on the pacemaker. This is a patient of RV overload with RV dysfunction. LV is normal, RA-RV is dilated. And this is another patient I told you of the right ruptured sinus of Valsalva where there was a frozen picture. Now you can see a mobile picture of this patient. Same way the flow going through the ruptured Valsalva. What are the technical problems? You can have narrow intercostal spaces, obesity, COPD, improper position, abdominal distension and an uncooperative restless patient. What are the sonographic pitfalls? You may have artifacts, you may have pericardial effusion versus pleural effusion and pericardial fat. And when you go to intensive care unit, patients are on ventilator, they are very sick, they are not in a proper position. So you may have difficulty, but still I think it is very easy if you to give a diagnosis at least, so that you can at least exclude certain parameters. So basically, to sum up, what I have told you is what views do you see, how do you use an echo equipment, what are the views, what are the planes, simultaneously when do the patients come to us and how do we help the clinician in coming to a diagnosis, and also in emergency echo how echocardiography is helpful in making decisions and coming to a diagnosis. Thank you.
Basics of echocardiography, that was the topic of our second session of teleconferencing program. Our expert was Dr. Sangeeta Sachdeva. We will be back with Dr. Sangeeta Sachdeva in our third session of our today's program with one more topic. The topic will be echocardiography in mitral stenosis. But before that, I would like to remind you that you are watching this program which is jointly conducted by Indira Gandhi National Open University and National Board of Examination. If you want to have the DVD of today's program, you can contact National Board of Examination. If you want to download the forms, you can in touch with our website. The website is www.natboard.edu.in, that is www.natboard.edu.in. And if you want to ask any queries about echocardiography in mitral stenosis, you can use your phone calls. Our phone numbers are 29532844, 29532845 and toll free number is 1800112345. Please keep watching our channel and we will be back after 15 minutes.